Good morning. My name's Sarah Bagley. I'm an assistant professor of medicine and pediatrics at Boston University School of Medicine, Boston Medical Center. And I'm going to talk to you today about working with families who are impacted by substance use. Just a note and a thanks to our funder, the Opioid Response Network, which is actually funded by SAMHSA. And there's some more details about this program, but it's providing training and technical assistance across the country to groups who want to learn more about substance use. I have no disclosures to make. So what are we going to talk about in this talk? We are going to first describe the current landscape of youth substance use. We're going to discuss the impact that substance use can have on families, and we're going to identify 3 ways that families can open communication with their children to talk about substance use. So as a starting point, just a reminder that families are allies. I think sometimes I work in a specialty primary care and addiction setting, and oftentimes family members come in, they have a lot of concerns, they have a lot of questions, and to be honest, they can take a lot of our time as we want to explain to them sort of what is going on with their child, why are we offering the kind of treatment that we are offering. And sometimes in those conversations, we can sort of lose the idea that they actually are allies and that they know the youth best. And they can be really reinforcing at home or other settings outside the clinical setting when trying to implement different kind of treatment plans. And this is true even when relationships have deteriorated, which often sometimes can happen when there is more prevalent substance use. Even though in those cases, it's really almost even more critical to understand how their feelings, their decisions, maybe even stigma that they have towards opioid use disorder or other kinds of substance use disorder, towards the treatment for substance use disorder, may actually impact the youth and the decisions that they're making. And so we always have a goal of trying to invite them with permission to be part of any kind of treatment and planning process. Before we get into more of the content, I want to highlight a really important idea that was a paper that was published this year, actually in Pediatrics, reviewing the importance of using appropriate terminology when we're talking about substance use disorder and this idea that words matter. And so the next couple of slides show the table from this paper and different kinds of examples of words that we can use and why we may use them. I'm going to highlight a couple of them that I think are especially important. So we try to use person first language. So someone with a substance use disorder, someone who uses opioids, cocaine, nicotine, cannabis, or a person who injects drugs, instead of using words like abuser, addict, junkie, heroin user, injection drug user. And so by doing this, we ensure that individuals are not defined solely by their substance use. We try to use terms like treatment was not effective, or the patient's in need of more support, higher level of treatment, not someone who's failed treatment or not someone who's been non-compliant or non-adherent. And this allows us to refer to the treatment not meeting the needs of the patient or the patient needing a higher level rather than the patient failing, which can be sort of even more, which can be stigmatizing. Some other examples that I think are just important to highlight for this talk is using terms like substance use disorder or addiction instead of using terms like drug abuse or dependence, substance abuse or dependence. And then trying to say, maybe someone is intoxicated or in withdrawal instead of using terms like strung out, tweaking, high, drunk, because then we're using medically accurate language to describe the state of intoxication or withdrawal from a substance. So I'd sort of encourage you to go to this paper and specifically this table and sort of become familiar with it. I think that we actually there's been some really nice research that has been done that has actually showed that the words really do matter, and that there have been even RCTs that have showed that using different words, same clinical vignette, but different words actually leads to different kinds of treatment recommendations. And so this really is important and actually can have a profound impact on the outcomes of our patients. So we're going to now get to the first learning objective to describe the current landscape of youth substance use. So, overall, since the 70s, the prevalence of substance use has been decreasing in the United States. These are data from Monitoring the Future, which is an annual school-based survey conducted in the United States. These are just showing from 2011 to 2021, and among 8th, 10th, and 12th graders, and sort of shows that overall prevalence has been sort of slightly decreasing. There was a more significant decrease from 2020 to 2021. I think there's some questions about whether or not that is COVID related and whether or not we're going to continue to see such a sharp rate of decrease. My hunch is probably not. But overall, this has been encouraging, and I think has led people to feel pretty good about sort of the different kinds of prevention efforts that have been implemented to try to reduce substance use among teens. That being said, the story is also nuanced. We know that overdose deaths are significantly increased among adolescents as well. So these are data that were published this year, looking from 2010 to 2021. Figure A looks at the overdose mortality among adolescents by substance type. What we see here is that there has been a significant rise, especially, starting in 2017, in overdose mortality, really driven by illicit fentanyls and synthetics, to a lesser extent by benzodiazepines. And then when we look at overdose mortality among adolescents by race and ethnicity, we see that American Indian or Alaskan Native non-Hispanic youth have the highest death rate per 100,000, followed by Latinx and then white. And then we also have seen a really significant increase among Black youth having overdose, even though it's the lowest death rate compared to other race and ethnicity. So, why is this? How can I be sort of telling you on one hand that the prevalence is actually decreasing, while on the other hand, the overdose death rate is increasing? And what we know is that the drug supply right now is really dangerous. It's been poisoned by fentanyl. And so even though overall prevalence can be decreasing, the drugs that people are using are riskier than ever. And increasingly, I think we're hearing about adolescents who maybe are actually very early on in using substances, but maybe exposed to fentanyl because they buy pills, and that result in an overdose. And so, I think that before we're going to talk a little bit more about specific strategies with parents, I think that one idea that I try to always impart to teens, but then also to families, is that behaviors make sense. We have this tendency sometimes to sort of pathologize substance use, and we try to sort of say that it's pathologic, that their brains have been hijacked. But when we actually sort of pause, sit down, have a conversation about, tell me a little bit more about your substance use. Tell me about sort of what are benefits of using drugs. How does actually your cannabis use help you? How does your alcohol use help you? Tell me more about the different situations where you're vaping. We're going to hear from teens that they use substances for a variety of reasons. Some of them might be related to treating different kinds of mental health disorders. Some of them might allow them to interact in social situations in a more comfortable way. And so we may then hear from them that maybe they want to stop, but maybe they're not totally sure they want to stop because there still are these benefits. And until they know that their depression is going to be treated and it's going to be effective, or their anxiety is going to be treated, or they know that they're going to be able to still interact with their friends without substance use, it's going to be really hard for them to cut back. And so pediatricians can normalize ambivalence about use with parents, which I think is really, really important, because I think oftentimes families are coming in, parents are coming in, and they're scared. They just want them to stop, and they don't understand why their kid just can't stop. And pediatricians can sort of help to frame this conversation around behaviors make sense. Ambivalence is really normal and it's expected. And then we can work with families and teens to develop safety plans around safe use, driving, open communication. And what we can share with parents is the more they understand about the motivations that their kids might have for using, the better prepared they're going to be able to respond and offer other sort of positive rewards or reinforcement about trying to decrease their use. A few words on parental substance use as well, because this is a topic that I think, we know that substance use disorder is a multi-generational issue, and that oftentimes we have patients who maybe we're seeing in primary care, and maybe also their parents may also have substance use as well. And the AAP actually sort of comments on this and has some suggested proficiencies for pediatricians. And the recommendations are that pediatricians should be aware of the medical, psychiatric, behavioral syndromes and symptoms with which children and adolescents and families with substance use present, and how important it is that be able to have like a timely early intervention. So we know that sometimes these youth are going to show up with maybe more psychiatric or mental health symptoms as well, or potentially related, depending on the severity of the substance use in the parent, potentially trauma. Certainly the pediatrician should be familiar with and able to direct families to community, regional, and state resources for children and adolescents and families with substance use. And it's part of the general health assessment of children and adolescents. Health professionals or pediatricians can include appropriate screening for family history, current use of alcohol and other drugs by the parents. And the pediatricians can then use motivational interviewing techniques to assist families in identifying problems. We can assist parents who screen positive and identify treatment options, and offer information, support, and follow-up for parents who screen positive. It's also finally important to understand state mandatory child abuse reporting laws and how to make a report to the responsible investigating agency. I know that some of this can maybe seem a little bit overwhelming. You're in a busy practice, you're trying to focus on your patients, and then sort of how can you also then be sort of trying to also think about the family and the resources or the treatment that the family may need. I think that we know too, though, that the children who we're caring for are going to be profoundly impacted by the environment that they're in, including if that environment has parental substance use. And so by focusing on the parents and ensuring that they have access to the right kinds of treatment, we're actually going to be improving the health of the children in the home. I'll give an example of that. I saw a patient recently, and she was being referred to us for alcohol use and depression. And throughout the course of the interview, we learned more about parental alcohol use. It was clear that it was having a profound impact on her own use. And it also became clear that it was going to be impossible to think about her decreasing her use without intervening with her parent. And so we did. When we called the parents back in, we talked to the parents about alcohol use. We talked to them about safe driving, and as a result, and about treatment options. And as a result, the parent has made some changes around their alcohol use in front of their child that seems to have a really positive benefit. So next, we're going to get to the next learning objective and identify 3 ways that families can open communication with their children to talk about substance use. So one of the most important tips that we have is to have a conversation before a crisis, which this is not rocket science. I think any of us who have been in any kind of conflict have realized it's just a lot easier to talk about things before they really escalate. And so we recommend that families try to choose a time where everyone is getting along. You can sit down and have a conversation about what are we going to do if you're in a situation where you are high, or you're around someone who's high and you're trying to get home, or you're a parent who is worried about your child's substance use, and you want to be able to address it, but you're not going to be able to address it in that moment that the child is maybe using or has just gotten home. And so you want to be able to sort of set up those conversations before you're in crisis mode, before you're going to have conflict. Certainly not to have conversations around substance use when someone is intoxicated or potentially having withdrawal symptoms. Those are not the times to have those conversations. You really want to have them when everyone is feeling calm and at their best. The other thing that we suggest for families is to use positive rewards or contingencies for desired behaviors. When we talk to families about this, there can sometimes be pushback. They will say, I don't want to reward my kid for doing something that they should be doing already, or I don't want my kid to think that I'm rewarding them for something drug, like they shouldn't be doing that anyway. Like why would I do that? Well, what do we know about human behavior? We know that when people are given positive rewards, they tend to change their behaviors over time. And so we have found that this can actually be a really effective way. And you can start really small, and you can even start with desired behaviors that are actually unrelated to substance use. So it can have to do with cleaning up your bedroom. It can have to do with clearing the table. It can have to do with helping out with other chores around the home or finishing homework. The rewards can certainly be sort of proportional to whatever the desired behavior is. We sort of joke around with families. This doesn't mean sort of promising someone a vacation or a car if they make their bed for a week, but you can ask the youth, what are something that you care about? What's something that you want to work towards? And that can be a really powerful tool over time. And then finally, I've talked about this already, but I'm going to highlight it again just because I think it's so important. It's addressing the underlying reasons for substance use. And so it's really spending time with families for them to really internalize this idea that behaviors make sense and that ambivalence that their teen might be showing is totally normal and accepted and expected. And that one of the most potent interventions that we can have is to understand the underlying motivations for substance use and really trying to target our interventions based on those motivations. And I think that the really successful cases that I have seen for reducing or stopping substance use is when families are really able to do that. I will also say it also provides them with tremendous relief, because I think sort of the push and pull of just stop using, no, I won't, just can be exhausting. And when you actually shift the focus and you can have them help them be curious around their kids' substance use, it can be a relief. It offers an alternative pathway that I think can also be really reinforcing for the family. Here are a couple of different resources and ideas for supporting families. The first is the CRAFT, which is an approach towards working with families when a loved one is not ready to stop using drugs. We certainly also offer overdose education and naloxone rescue kits to all of the families that we take care of, because we know that although some of our patients have opioid use disorder, a lot of our patients may be experimenting or using pills, may be inadvertently exposed to fentanyl, as we talked about that sort of increasingly in the drug supply, and it is a significant risk for having a fatal overdose. And so we want to make sure everyone in the home knows what naloxone is and how to use it. We also, recommend for some families that they find mutual support groups so that they don't feel so alone. This is especially helpful, I think, for families where there's more severe substance use disorder. And then Smart Recovery, too, is an evidence-based support system for a family or treatment for families. This is just, I wanted to highlight the Partnership for Drug-Free Kids, or the Partnership to End Addiction is what it's called now, which is really focused on providing resources for families of adolescents and young adults. And there are a series of videos, there are toolkits, there's a hotline and a chat line that parents can be in touch with. And they really provide the continuum where there are resources for families where maybe kids have not started using drugs, but sort of what to look out for. And then there are resources for when a teen or a young adult may have a more severe substance use disorder. So I highly recommend using their resources. They're very high quality, and I think can be really helpful for parents, and even actually for you as pediatricians to sort of read through and can get advice that you can also give to family members as well. So just want to put it all together. During adolescence, parents or caregivers may be less involved in visits to the pediatrician. We know that, I have younger kids, and anticipatory guidance is a key part of what's happening in a lot of our visits, but those tend to decrease in time as we sort of are trying to give more autonomy to our teens. And although we want to encourage this transition and assure confidentiality, parents may still have a lot of questions. And so there are a lot of opportunities to think about trying to at least offer them resources or time to have conversations around drug use. so that they can appropriately reinforce that kind of messaging at home. And so it's important to sort of consider different ways to offer this kind of guidance that doesn't violate the confidentiality that your patient has placed in you. Thank you so much for listening today. We're going to ask you to fill out our brief survey. There's a link there where you can take a picture of the QR code. If you have any questions, please feel free to reach out. My email is there, sarah.bagley@bmc.org. Hope you have a great day.